Good afternoon, everybody. Mark Zusman from Willamette Week here for another Distant Voices. We are very fortunate today to be here with Dr. Helmi Lutsep, who is a neurologist who has been specializing in the treatment of strokes at OHSU for years. I think I read in your bio somewhere that you're the editor of, is it Stroke Magazine? I'm sure I have that a little bit wrong.
So I've got a couple editorial roles. I'm a chief editor for eMedicine from WebMD, and that's for neurology in general. And then I am also an associate editor for the Journal of Stroke.
The Journal of Stroke.
Mm-hmm.
So, Dr. Lutsep, I'm really looking forward to chatting with you for a few minutes today, because as we are now all learning, COVID is not just a respiratory ailment, it is actually showing up vascularly. And one of the symptoms or consequences of getting COVID for a certain percentage of the population is that they get a stroke. So can you, with an understanding that you're not speaking to medical patients here, but to a lay audience, what is a stroke?
So a stroke takes two forms. It's either a blood clot that blocks a vessel and then prevents flow from getting to that certain part of the brain, or a stroke can also be bleeding into the brain that's caused by rupture of a blood vessel. So the kinds of strokes that the patients with COVID are getting are more commonly due to the blood clots.
So do we know, for example, of what percentage of people who are infected with COVID suffer from strokes?
You know, we probably don't have an exact percentage, but I would say it's probably not higher than about 10%.
Yeah, I've done a little reading and I get like 5 to 8%.
Yeah.
So on the one hand, if you get COVID, you are likely not to get a stroke, but at least based on colleagues of mine who are rather friends of mine who are in the medical profession, what they all tell me is the last thing you want to get is a stroke. All the adverse things that can happen to you, a stroke is about the worst. So explain that again to us lay people. What are the consequences of having a stroke?
Yeah, a stroke can affect your functioning. So depending on which part of the brain is affected, people can become paralyzed on one side, they can lose the ability to speak, they can lose vision, numbness. So it's considered, some patients, many patients actually, will tell me it's worse to get a stroke than to die, because in their, from their perspective, to live with that kind of disability, it really robs you of the person that you are.
So Dr. Lutsep, I could be wrong, but I have been reading that, traditionally strokes is something you think of that older folks get, but that there have been some examples where younger folks are getting strokes from COVID. Is that correct?
That is correct. There was a series that was described in New York City in which the patients were quite young. This is not something that's been described everywhere. In China, for example, and the Chinese had some of the first descriptions of COVID, the patients were on the older side. They were not younger, but clearly it can affect patients of any age.
And have you seen some patients who've been infected with COVID and had a stroke at OHSU?
You know what? I have not. And I think that that is most likely because we have not, thank goodness, had all that many patients hospitalized.
Right. Oregon is still outperforming much of the rest of the nation in terms of infections and hospitalization and mortality.
Yep.
But numbers are spiking up.
That is correct.
And one of the other reasons why I wanted to talk to you, Dr. Lutsep, is because there is a lot of data to show that if you pull out from Oregon data the number of people who have died of COVID, we still have an abnormally high death rate compared to historical averages. And a lot of folks think that's either because people are dying of COVID, but they haven't been diagnosed, or that people are afraid to come to the hospital when they have other symptoms because they're afraid of getting infected by COVID if they go to the hospital, and they're staying home and getting complications. And I know that there has been a period of time during this COVID epidemic where the number of stroke patients that OHSU and other hospitals were admitting was way below the traditional numbers, suggesting that there are people who are experiencing strokes at home and perhaps are not coming to the hospital because of this concern that we all have about staying away from the emergency room.
Absolutely.
Is that correct?
Absolutely correct, yes. And a paper has been published in JAMA Internal Medicine that suggests that these excess deaths, the deaths that aren't potentially due to COVID, they're seen nationwide and not just in Oregon. So as you pointed out, we don't know. Some of them may have had COVID and there may not have been sufficient testing, to note that. But there really is a strong sense that that does not explain it all. And that we really are seeing the effects of people not coming in for care.
And I spoke to a doctor who said they, on autopsies they've done on COVID patients, they're finding an increasing number of autopsies in which they find hundreds, if not thousands, of tiny little clots in capillaries. So I know that oftentimes you think of a stroke as you get one clot in an important vessel and that's it, you have a stroke. But it sounds like what COVID does is it creates all these mini clots so that potentially people have smaller but many more mini strokes. Is that correct?
Yeah, they're not necessarily all clots in the brain. These patients are getting clots throughout their bodies. So there is something about the COVID that's causing clotting.
All right, so now for all of us at home, those of us who are hypochondriacs, we're imagining we have symptoms of a stroke. And for the rest of people who ignore that, what are the signs to watch out for?
So we talked about some of them in terms of disability. So strokes usually occur suddenly. So that's one thing to look for already. So if there's sudden weakness on one side of the body, sudden trouble talking, sudden numbness, sudden loss of vision, or really other things that occur suddenly and might not fall nicely into that list, whether there's one symptom or multiple symptoms, that is worrisome. And as we say, then you need to act fast and call 911, get to the hospital, because the longer you wait for treatment, the more likely it is that those symptoms are going to stick.